I've been waiting for the longest time to share my birthing and pregnancy experience. I think the right time is now. Sit back, grab your popcorn. It's about to be a movie. I'm going to start with my son because he's the most recent, and let's just start with that before I tell you that of my daughter. In 2023, after my birthday, I mean, after flexing and up, jumping up and down, I think what was on the my birthday was on the 16th of September, and by 19th of September, 3 days after my birthday, I find out I was having baby number two. That news, I didn't even know how to react because one, we're not planning to add another baby. As my daughter just turned one. I mean, like she had not even turned one before I found out. She was going to turn one 27th of September, and I found out I was pregnant with baby number two 19th of September. How that news made us feel, I don't even want to talk about that one in this video. Maybe another video, sha. I found that I was having another baby. Maybe it's a blessing, right? After the emotion of, hey, how am I going to handle it? My daughter is still small, this and that. I had started fashion school. History long. But of course, I'm a married woman, and what do I expect to come out of marital duties, right? If not a baby. Okay, so I found out I was pregnant, and I took the news. We got off the shock, and the journey started. First 3 months, I was glowing. The glow, it was on another level. People asking me, what's your skincare routine? I was like, if I tell you people that it's pregnancy, will you people run away? Okay, so I was just shining like that. And after I didn't even have morning sickness. No morning sickness, no spitting, nothing. I was like, God, it's like I've got a hang of this pregnancy thing. I'm not an experienced pregnant woman. Okay, and when I got to 5 months, the baby was like, hold my glass. I became so fragile. I could not do anything. Like all I was doing at that point was existing. I was just existing and trying to cook because I don't like to eat other people's food. Like eating out and letting someone else cook for me is not what I like. We see every other chore. Sweeping. I can't even bend my waist. I can't bend my waist. If I bend, is war. If I stand, is war. If I sit, is war. If I lie on this side of the bed and I wake up, like when I'm sleeping and I lie on one side of the bed and I wake up, it's as if the waist, that place I put on the bed has dislocated. I will not turn and shoot small, small and put on the other side. I'll wake up and see that one has dislocated. And I wait. Oh, I thought I was just flexing a few months ago. What has happened? What has changed? I managed like four. That started at the 5th month, the 6th month. Towards the end of the 6th month, contraction setting. I started having severe contractions. I went to the hospital and they were like, what happened? Why did you stress yourself? I'm like, I don't do anything. This baby had turned me to one overnight ajebo. I don't do anything. What I do is just cook and eat. They said, okay, fine. They're going to admit me because it's not even up to 7 months. And this baby cannot come out now. They admitted me. They put me on drip, gave injection, monitored, checked my blood pressure. They said it was okay. I think I was in the hospital. The first time I was admitted, I was in the hospital for like 2 days. They kept checking the baby's heartbeat, and after 2 days, the contraction stopped. And they gave me one drug, I think nifedipine, if that's how it's pronounced, to stop contractions. So I got back to the house and they told me from the hospital whenever I feel the contraction, I should take the drug. That became my new lifestyle alongside my pregnancy vitamin, multivitamin that I was taking. I started taking that. Like it was just like taking a money out and anytime I feel the contraction, it didn't stop. I managed, entered the 7th month, the same thing. It's like some days are more serious than others. Any day it gets so serious, I have to be rushed to the hospital. The same routine over again. Put me on drip, give injections, check my blood pressure, check the heartbeat of the baby. It was a lot. I think I was admitted up to like 5 times before I gave birth. I managed like that. Severe pain, like the baby wants to come out. If I walk, it's as if the baby wants to come out. If I sit, it's as if I even had to cut my hair. I had to cut my hair. Everything was just stressing and irritating me. If you even breathe loudly around me that period, I'll just feel like eating you because I was going through hell. Imagine having constant contraction and having to take drugs, be rushed to the hospital. People hearing that you're packing your load to go to the hospital, thinking it's baby you're coming back with. They'll tell you it's not time. They don't want to bring out the baby and have to put the baby in the NICU because the baby is not mature enough. No, madam, please manage. How am I going to manage this pain? Everybody just advising me manage, manage, manage. But of course, it's the right thing that they are trying to do. So, who am I even angry at? It continued like that. Almost every week, I'll go to the hospital. I'll go and complain. I'm sure the nurses were even tired of me already. This woman, you're here again. I'm like, I'm in pain. I'm in pain. This baby keeps wanting to come out, and it's not time. That kept happening until one day. I think it was that time. It was already 37 weeks, like 2 days. I went for my CDS clearance. I was even serving that period. I went and I had to spend some time because they were just stressing it. It was around final clearance. They were just stressing us up and down. When I got back to the house, and that was just like the peak of everything. When I go back, it was just like I was going to pass out. I was just panting. I was just panting. It was like, okay, maybe it's hunger. And I'd eaten, but I just wanted to find a reason to stop whatever was going on in me. My eyes were turning. I was feeling dizzy. I just felt like falling. Everything was just happening to me all at once. I was having severe contraction. I ran to the kitchen. I ate bread. I took tea. I drank kunu. I took water. I think there was even some more and soup I ate. I just stuffed things in my face, thinking, okay, maybe it's hunger, but I just didn't know. So after stuffing food in my face and I was so filled to the brim, like there was no space for me to put anything in again, I said fine. And my husband was not around. I didn't even have the strength to say, okay, I was going to order boots to get me to the hospital. I called my husband, I told him I was feeling, and he said, okay, what are we going to do now? Can you find your way to the hospital? I said, no, I just want to rest first. He said, no problem. Let me give him few minutes and I should try and put myself together. If nothing changes, he's just going to drive from the office and come and pick me and we'll go to the hospital. Like, it was 37 weeks already then. So after I ended the call with my husband, I just prayed. I said, God, please help me. Please help me. This way is not time. And the contraction is not even the worst feeling. Like I feel like I was just going to pass out, like I was going to faint. I prayed and finally I was able to fall asleep. I slept. When I slept, then you know that kind of sleep that you sleep, you don't know if you even wake up. I slept for like an hour, and when I woke up, I was surprised. I woke up. I mean, I thought I was going to die. Seriously. And when I woke up, everything was gone. Everything had subsided. And sincerely, at some point, I stopped taking that nifedipine and be highly pronounced that I was given from the hospital because number one, I was just taking this thing too much. I'll ask the doctor, is there any side effect? Not for me, but for the baby. Why am I taking something to stop contraction? If this baby wants to come out, let the baby just come out. After all, my mom said she had all of us at 37 weeks, and my sister was born at 7 months, and she's fine. So if this baby wants to come at 7 months, me let the baby just come. I was just tired of taking this drug because let me not come and give birth now and they'll now find that maybe the research did not cover, maybe excessive taking of this drug is going to affect the baby. I just didn't want to hear anything like that. So I stopped taking pain. My husband is going to find out from this video. He didn't know. I stopped taking it. When I got to 36 weeks, I stopped taking it. So that day, as God will have it, I woke up, I didn't die. So that was like on a Friday that I had that experience. It was 37 weeks, like 2 days. It was on a Friday that I had that experience. And on Monday, oh God, I had this severe case of contraction. And the problem with this contraction is not progressing. I'll have the pain for like maybe 2 minutes, severe pain, hard contractions, like 2 minutes and then to stop. It will not come again for another 30 minutes. And that is not active labor. Active labor, it will start slowly and then it will begin to progress, and then the space between one contraction and another gets shorter. Maybe it will start maybe 20 minutes apart and then 15 minutes apart, then 10 minutes apart, then 5 minutes. But this one, I will experience it for a stretch, 2 minutes and then to stop. 1 hour, 2 hours, I'll not feel it again. Then another a minute to just come out of nowhere, and I experience another minute. I'm just in severe pain. Oh my God, please, who did I offend? Who did I offend? So I went to the hospital on Monday. That was on the 6th of May 2024. We got there, I think around 2 p.m. We saw the gynecologist on duty. He checked me and said, Madam, this thing again. I said, yes. So you see, you two are asking this thing. Even me, I am tired of coming here over and over again. I want to be done and over with this pregnancy. I don't want to do it again. He said, Madam, so what do you want? I said, I want an induction. He said, this baby is 37 weeks and how many days? And then it was 37 weeks and 4 days. He said, it's quite early. Oh, if I can manage. I said, I cannot manage again. No. I have been managing this thing since 6 months. I cannot manage again. He said, Aisha, I said, yes. He said, okay, it's 2 p.m. It's already late to start prepping you for an induction. That, okay, they are still going to give me that nifedipine again. I said, me, I'm not taking anything. I'm not taking anything. He said, fine, okay, just take paracetamol. We'll give you paracetamol. Go home, you and your husband, go and think, go and sleep over it, and come back. If you know you've made up your mind to be induced, come back tomorrow morning by 9 a.m. I'll be 8 a.m. and we are going to do it. I said, fine. We got back home. My husband was asking me, is this what you want to do? I said, Oga, I can't take this pain anymore. You man, you're not tired. Every day we are running to the hospital. Every day they'll say, take this. Every day, are you not tired? He said, but doctor said it's not. I said, me, I don't want. I want to be induced. And I already even packed my hospital bag because all of the drama of going back and forth, I don't want us to end up going one day and I'm like, okay, let's just deliver the baby. So I packed my bag from like 6 months or 7 months. I had already packed my hospital bag. He said, okay, fine, if that's what you want, tomorrow we'll go to the hospital and get you induced. I said, fine, that's what I want. My mind was made up because I was just tired of the constant pain. And that night, I sat on my bed and I asked God, I said, God, I don't have put this baby there, and you know all that is happening, and you know that I've reached my limits for this back and forth. If the full contraction comes and it's active labor and I deliver the baby, I know that okay, I'm done with the pain. But this one that it keeps coming and going is tiring. I can't do this anymore. Please, I want to go get induced tomorrow. Please help me. I said that prayer and then that was it. Tuesday came, which was 7th of May. We got ready. My husband was still asking me, baby, is that what you want? I said, that's what I want to. We got to the hospital. We even arrived late. I think got to the hospital around past 9 to 10. My sister-in-law, God bless her heart, she came to give us moral support too. And when we got to the hospital, the doctors decided to give us another consultation session. Abi, how is it called? Madam, okay, I want to tell you what all of this entails. If you get induced and the induction fails and you don't go into active labor, with the fact that this your contraction is coming and going, and you're not going into active labor yourself. If we induce you and you still don't go into active labor, it will end up as a sick session, because we cannot induce you and the induction will fail and will not say go back home. The baby must be delivered the moment the induction starts. Even if the induction fails, it's going to be a CS. The baby must come out. Are you ready? I say I'm ready. Turn to my husband. Okay, you have to sign that you give approval that she should go on with the induction. My husband say, he cannot do it. Oh, say he doesn't want to be able to give the go ahead. That I should be the one to give the go ahead, that he'll feel safe knowing that I'm the one that decided that I was going to have a baby today. And if it has to end up as a CS, at least I would know that it was my decision. Galawan. I said no problem. At that point, there was nothing that was going to change my mind. My mind was made up. I said no wahala. I give the go ahead. I told the doctor that after all, this is my second induction. I know how my body works. I'm going to go into active labor. I was speaking with confidence. I got induced at, I think, some minutes to 12. And then we started waiting. I even went to the hospital with one book like that I was reading. Past 1:30, some minutes to 2. No active labor per se. They'll come and check me. They'll say, still 2 cm. This thing is not progressing. Oh, my husband will look at me. The sister will look at me. I said they should not worry, it will progress. 2 p.m. the same thing. My sister was just laughing, say, so that is liver cannot be reading book. Like the fact that you can concentrate to read book. This baby is not coming, no. I told her not to worry, that the baby will come. So I think it was around 2:30. We went to the hospital in my firstborn, my daughter. My husband said, fine. Since the pain has not started, he should take my daughter home and try to feed her, because we didn't pack food to the hospital. So he said, I said, no problem. He took my daughter home. I think it was already 3. And my sister said, okay, and since I'm still reading book, Madam Professor, someone that is labor that is reading book she has not seen before, that maybe let her go and cook for her children that is gone and will soon be back, that she thinks even if this baby is going to come, it's going to be like maybe around 7 p.m., 8 p.m. in the evening. That right now, with what she can see, baby is not going to come anytime soon, that she wants to go. I said, no problem. They now moved me to private ward. Let me go and sit down there and be reading my book. Now I now sat there. After they left, I think they left at around 3. And by 3:30, the doctor came and said I should come for him to check me. That I should just come into the labor ward. He doesn't want to check me in the private ward. That after he checked me, I can go back. I said fine. But they said I should just carry my baby bag just in case. I was not feeling any pain at that point, so just small contraction I was just feeling. I went to the labor ward. I lay on the bed and the doctor checked. Surprisingly, 6 cm. Doctor said the fact that he saw me there, no pain. He was just like, what is he going to tell this woman now? Maybe we'll have to put another round of the drug that they used for induction rather, and see what will happen. But right now I'm 6 cm dilated. And I said, fine, they should begin to prep the word for me to have my baby. And they said I should call my husband. My husband had not even landed in the house. Like, I don't call and I say, hello, sir, your child is coming. He said, what did I say? I said, yes, so baby is coming. I'm already in the labor ward. He then said, I'm coming back, I'm coming back now. So he had to drop my daughter for our little niece that is staying with us, and then he called the sister and said, sis, come, the baby is on the way. Even she's not even get to her house. They all turned back, and then the doctor now said that he's going to help me break the amniotic fluid, right? I mean the, what is it called? Yes, that is going to break it, because that time my water had not broken. So he now said if he break it, it will fasten the process, right? And it will make everything easy for all of us. But that if he does it, I'm going to start feeling severe pain. But he just wants to be able to deliver the baby before he leaves. He closes by 5 p.m. and it was already 3:30 to 4. So he does not want another person to come and take over. He said, Madam, do you approve? I said, yes, I approve. And then he decided to break the water. After that, oh, hmm, my mouth cannot explain the kind of pain I was thrown into. I saw a video of one lady like that saying that mothers, people who have given birth, should come and explain to her or them who are yet to have children what labor pain feels like so that they will know. Not to scare you, but all I can say is no one can explain that pain for you. Nobody. There's no book, no audio, no video. Nothing can prepare you for that pain. Some claim the induction pain is more painful than going into active labor yourself. I can't either agree with them or not because for both my children, I was induced and the pain. Hell, I screamed. I screamed. Daddy, oh, and my innocent father that is in the village is the one I always call whenever I'm in pain. I started screaming. And that time I could hear my husband by the door. He was just praying. My sister-in-law was back and they're like, hey, this shout is louder than the first time. Oh, what's happening in there? I could touch every pain. I could feel every pain. I was just asking questions. I was like, God, if this is how this is painful, how did my mother go 6 times? What did I promise that woman? How did she go 6 times? I'm not doing this again. Never, never, never. I'm not doing this again. I'm not doing this again. Not see anybody will tell me. Nurse said, hey, madam, reserve your energy. You need this energy to put. I said, don't tell me what to do. You cannot tell me what to do. She said, ma, but reserve your energy now. You need all this strength that you're using to shout to push. I said, just leave me alone. Allow me to shout my shouts. And that's how I'm feeling. Just leave me alone. Leave me alone. I was screaming. I was crying, Jesus, 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 help me. Talking about it now, I'm laughing at myself. But it was painful. And then they checked again. They said I was 10 cm and it was time that I should get ready. They put me in the position that I was supposed to stay. Did not say, don't push until I ask you to. Don't push until I ask you to. I said, no problem. I was just gathering my last strength. My consultation was that all the pain, all the stress, everything was going to end at that point the moment this baby come out because it has been a very, very chaotic, calming months for me. Starting from 6 months, I've been in this pain and I just had that confession, I'm fine. The moment this baby come out, all that pain was going to be over. So at that point, I gathered strength and they asked me to push. I pushed one. They said, see there, see there. See there. Push two. The second time I pushed, the baby came out. Ah, God, what peace, what joy, what stillness. All the pain, all the anguish, everything ended that minute. It ended that minute. Hmm. You see what I'm doing? Nobody can explain that feeling to you. Nobody can explain that feeling to you. It was a feeling of, Father, the baby is here. Father, the pain is gone. Father, I didn't have to go through CS to bring the baby out. It's all over. I was just overwhelmed with joy. I was overwhelmed with joy. I mean, and you see this baby, the baby was so big. Doctor just looked at me and said, ah, is it the baby that they were scared to deliver? That madam, you don't know when you got pregnant. I say, even me, it's like I really don't know when I got pregnant. I just found out in September that I was pregnant. You know, I said this baby is more than 37 weeks. This baby is old. If you see his thighs, big, big. Like he was so fat. He weighed almost 4 kg. I'm like, I just looked at him. See this boy. You have been stressing me. But he was just a fine little yellow human being. And it was love at first sight. He just started crying, nah, nah. And next thing, then I said, my husband should come inside. He not came inside. He was not angry with the doctor. The doctor traumatized him. The one who doctor like to come inside and have that side that his mind go. That is that what women go through. Doctor say yes, he did it intentionally. So that by the next time he's looking at me, he'll put some respect on that name because it's not easy. The baby was big. I even had a tear. I had to get stitched. But all that pain was nothing to me anymore. The fact that my baby was here, whole and hearty and everything, the pain was over. When I was getting stitched, I didn't mind. I got stitched and I was transferred to the private ward and I was cleaned up and they asked me to take Kuzi. Look Z boost, I think. Look Z boost was the first thing I took. My husband was over the moon. The baby is here. Now had his head. His shape of head. They're like the baby looks like him. That was how everything ended. And as we used to say it over here in Nigeria, it all ended in praise. It all ended in praise, and I'm grateful to God. Right now, that baby is here, eating, swallow, eating everything that we eat now. He can even eat chicken. To the glory of God. That was my pregnancy and birth story. Wait for part 2.